continue to ramp up their efforts to combat COVID-19 outbreak. A ER doctor tells me for first responders, their fight has just begun.
Assuming that every single patient has coronavirus at this point.
You may remember Dr. Carlton Stadler.
Shifts are 9 to 10 hours.
I spoke to the ER physician back on March 16th.
In a lot of ways, it is business as usual, but there is some level of controlled chaos. There is some level of controlled fear.
Now, nearly 2 weeks later,
I think a lot of providers feel as if they're standing on a beach and they can see the tidal wave coming.
a member of the Virginia College of Emergency Physicians, Stadler admits his colleagues are tired.
You know, one of the problems that we're running into at this point is running shortages on medications and blood.
First responders often wear just one set of protective gear their entire shift.
But now we have concern that what's happening to this patient could be happening to them also.
He shared with me a CT scan of a confirmed coronavirus patient. He says the disease appears like ground glass in your lungs.
Now we're in a position where every single patient is high risk.
I asked the doctor, based on his experience, to predict what's next.
2 weeks from now, we're going to start to see staff that are infected. And I think that's going to start to, again, chip away at some of the strength of the providers in the department.
And his fear a month from now?
2 weeks from that, the prediction is that we're going to be saturated, our ICU beds are going to be saturated. I think that's when we're going to run into a ventilator problem.
But the doctor says we can all stop the spread of this virus.
I want to hammer home how important it is for people to stay home. Sheltering in place.
And during our candid conversation today, Dr. Stadler could not stress enough the importance of social distancing yourself from others, staying home if you're sick, and please wash your hands. Working